Hi class, in this video we're going to focus on spinal nerve and the plexi of the spinal nerves. This is going to be in exercise 19 of your lab manual. So as we look at these branching networks of nerves, they're organized by the plexi. The plexi are named for the vertebral, or the vertebrae they emerge from. So we have some plexi associated with the cervical vertebrae, the brachial and the lumbar vertebrae, and sacral vertebrae. But there's also the plexi of the upper arm. There are no brachial vertebrae. The brachial plexus is actually going to have nerves originate from the cervical vertebrae. So that's a little bit of the odd duck out when we look at the nomenclature. So here in visible body, I have our nervous system pulled up. We'll start from the top. To highlight the cervical plexi for you, I'm going to use a lot of the search functions here within visible body. So here I have used the breadcrumbs in the upper right hand corner of the screen. So you can see, this big group branching network of nerves up here. This all collectively is referred to as the cervical plexus. And then here, I'm on the upper right hand corner of the screen. We have brachial plexus. Right there. So this branching network of nerves right here that I've zoomed in on, this is the brachial plexus. For our lumbar plexus, we're going to go a little bit more inferior here and focus on this branching network of nerves that comes out of the lumbar vertebrae. And I want to note for you that if we zoom out, the nerves downstream of the lumbar plexus, they tend to form or innervate the anterior of our thigh. So the anterior of our and medial margin of our thighs are innervated by the lumbar plexus. And then our last plexus is the sacral plexus. To review, here's the sacrum. And then emerging from the sacrum is the sacral plexus. And that sacral plexus is going to be the posterior of the thigh and most of the lower leg as well. So I lost my highlighting there. Let me go ahead and re-highlight that for us. I'll click on that sciatic nerve and then re-highlight the sacral plexus. There we go. So here we can see the sacral plexus innervating the lower leg. So those are the four main plexi. Let's focus on individual nerves. So let's first, within the cervical plexus, start from the top. The phrenic nerve. This nerve is the nerve that innervates the diaphragm. So it'll send muscular information to our diaphragm. So as we're looking at this model here, I'm going to go ahead and get rid of the thoracic cage entirely, just so it's a little bit easier to see the nerves that we're looking at. And we don't have as many nerves in the way. Now I like to look for where the diaphragm is located. And I'm having a hard time seeing it right now. So I'm going to punt and just type in phrenic. So here we have shown the left phrenic nerve. And we can see how it's this branch, it kind of branches outward to hug the diaphragm. I'm going to add the diaphragm. So now we can see that diaphragm that's been added here in visible body, that muscle of inspiration that we use to breathe in. And then the nerve associated with the diaphragm right here is our phrenic nerve. So that is the one nerve we want you to know from the cervical plexus. Next we have the brachial plexus. We have the axillary nerves. It's the first nerve of the brachial plexus. And our axillary nerve is the nerve associated with the armpit, or armpit area, or axillary region. And even though it says axillary, it's actually the outer shoulder on most teaching models. Yes, it does go into the axillary region, but I always look for this one that's proximal and lateral. The most proximal and lateral nerve on the upper appendage. That's going to be the axillary nerve. And then we have the musculocutaneous nerve. This musculocutaneous nerve is going to innervate the anterior of the upper arm. So let's see if I can click on it here. There we go. That is our musculocutaneous nerve. Note that the musculocutaneous nerve starts up in the axillary region, but it's going to travel down to the full upper arm, the brachial region, and note that it's anterior to the humerus. So it's going to be the anterior of the upper arm. Then we have the median nerve. The median nerve, ulnar nerve, and radial nerve are in the forearm or lower arm. And I want to emphasize it's median, it is not medial. So the median nerve is in between the ulnar and radial nerve. Now the ulnar and radial nerves, well, they have really straightforward names. They're named for the bone they're next to. So right here is the radius. Come on, radius. There we go. Took 3 clicks apparently. So there's our radius. So right next to the radius here, that big nerve, is the radial nerve. And that's the superficial branch of the radial nerve. I can go ahead and highlight the entire radial nerve for us. There's a deep and superficial branch associated with the radial nerve. We are not going to ask you to differentiate those branches. On the lateral medial margins of the forearm, by the ulna, we have the ulnar nerve. So that big nerve towards the midpoint of the body is the ulna, and then in between the ulnar nerve and the radial nerve, we have another big nerve. That is the median nerve of the forearm. So those are the nerves of the brachial plexus. Let's move on to the lumbar plexus. We have the femoral, obturator, and saphenous nerves. Let's go back to our model. I want to go to the obturator nerve first. It's named for the obturator foramen. I'll go ahead and annotate that here in visible body for us. Right here, that big opening is the obturator foramen. That's going to be the largest foramen of the body. No, it's not the foramen magnum. It's the obturator foramen. And then if we look at this structure, come on, visible body. Come on. Right here, emerging through the obturator, we have the foramen, we have the obturator nerve going out through the obturator foramen. Now as we look at the femoral nerve, I want to emphasize the femoral nerve is going to be on the anterior of the thigh, or the front of the thigh. So there is our right femoral nerve, here is our left femoral nerve right there for us. I can rotate around, and I just want to emphasize here, as we look at this, notice how it goes to the anterior of the thigh. And there's one more nerve associated with the lumbar plexus that I want us to know, and that's the saphenous nerve. As we look at the saphenous nerve, it's also going to be associated with the saphenous vein. And branches off of the femoral, right up here is our femoral nerve. The saphenous nerve branches off of the femoral nerve. And I want to emphasize here how that saphenous nerve goes all the way down. So it goes the length of the leg along the medial margin of the leg. Just like the saphenous vein goes the entire length of the leg along the medial margin of the leg. We'll talk more about the saphenous vein in A&P2 when we cover the circulatory systems. So that's the lumbar plexus and the nerves of the lumbar plexus. Next we have the sacral plexus and the biggest nerve of your body, the sciatic nerve. To give you a good reference point, the sciatic nerve is about the thickness of your thumb. And the bigger your thumb, usually the bigger your sciatic nerve as a rule of thumb. So the sacral plexus and the sciatic nerve are posterior. Here we can see how, wow, that is a big nerve. And as that sciatic nerve, as we look at that sciatic nerve, it extends down the posterior of the thigh. And then there's some major branch points. We have the tibial and common fibular nerve. And those branch points are named for, well, you guessed it, the tibia and the fibula. So from that sciatic nerve, we'll have the common fibular nerve, or the fibular nerve, as it's oftentimes just referred to as. and that will then have some subdivisions we're not going to cover in this class. And then towards the medial margin of the leg, the sciatic nerve branches to form the tibial nerve, which, as you would guess, goes next to the tibia bone. So that's all we have for this recording on the spinal nerves and plexi. If you have any questions or comments, please feel free to post them in the class discussion boards or to shoot me an email. And as always, happy studies.